Representative Parejon, thank you so much for talking to us about your proposal to change the way we tax alcohol and to do some different things with it. Right now, according to your cheat sheet, that's very helpful, right now we tax alcohol at different rates, whether it's hard alcohol, beer, wine, and if it's local, it's a lower tax rate. And you're proposing to just freeze that the way it is, but you want to spend that tax money slightly differently. What do you want to do with it?
I think the most important part about this bill is that we are amending the way that it's distributed. And so what that means is previously we used to use alcohol-related injuries from 2000 to 2002, and that was frozen as a number, so it wouldn't change or update. And then we used gross receipts tax. So counties that had a lot of tourism, for instance, got more of the fund, even if their alcohol-related deaths were lower. And so now what we've done is we're using population, and we are also using alcohol-related deaths. And so what that's gonna do is that counties that suffer a lot from alcohol-related deaths, disease, they're gonna get a lot more of the funding and be able to treat a lot more people in their counties.
Now, the second part of this is that you want to impose a new alcohol tax. I heard you say earlier that New Mexico hasn't changed its alcohol tax rate in 30 years, but you want to put a 6% kind of sales tax that I would pay at the restaurant near my house, and you want to distribute that money in a new way. What's the philosophy behind the way you want to spend the $30 to $60 million a year that new tax would bring?
So I'm the youngest woman in the New Mexico legislature in almost 90 years, so this tax is actually almost as old as I am. And so the philosophy here is really bringing our spending into the 21st century. And for me, that means that we are putting the money where it's most needed. This 6% tax, first, a portion of it will be going to UNM to do research about how the tax will work in our state. We want to make sure that as we are investing, it's getting to the right places, to the right people. And then the part where we're sending it to IAD to distribute from a council, that is really another big value statement that we're making.
And that's the Indian Affairs Department?
Yes, the Indian Affairs Department.
And so talk to me about that value statement.
Right now, there's a big attack on all our institutions, really bringing some of our institutions backwards in terms of equity. And I'm talking about the Trump administration. And for our legislature to say, you know, we still care about making investments in our communities that are hurting the most, including our Native American community that suffers the most harms from alcohol disease. And we don't even have a Native focused treatment center in our state. Folks have to go out of state for that. So this is really what we're trying to say with this amount of dollars, is that we want to stand up. Our legislature is committed to helping those who are most in need in our state.
So, I mean, there are a lot of ways that you could have spent the $30 to $60 million a year after the research phase. I imagine that there are other constituencies who are saying $30 to $60 million is a lot of money. Why give it all to Indian Affairs? Did you think about spending it in different ways?
That's a great question. We are spending $50 million still for the rest of the state, so there is quite a lot. There's a really great quote that I love that's, you know, if there's multiple houses that are burning, or one house that's burning, you don't go and put water on all the houses. You put water on the house that is burning. And for a lot of our Native communities, alcohol disease is a really one of the #1 killers. So we want to make sure we're putting the resources where it's needed and really get the numbers on average of our state down.
Cindy Sockerman, you are the founder and director of the New Mexico Tribal Behavioral Health Providers Association. So you work with all of these folks who are on the ground in Native communities in New Mexico, looking at what alcohol and substance abuse looks like in those communities. Why is the need greater there?
So for generations, tribal communities have had multiple disparities, especially when they're targeted for alcohol in general. I work with a lot of tribal communities. I'm also an evaluator. So I work with a lot of tribal communities where alcohol liquor establishments are surrounding tribal reservations that are dry, which means they wouldn't have alcohol near them had these establishments not targeted them, not only with price reductions, special sales, and these health disparities have impacted tribal communities for generations. And so having funds to address the needs of communities, the cultural needs of tribal community members. And in addition to that, we constantly hear, especially in our association, how community members are being sent out of state for treatment, for recovery. And I know that our detention centers are being used a lot of the times as behavioral health because they don't know where to put people. But we know that detention centers and the criminal justice system is not set up to address behavioral health. But in tribal communities, those detention centers are also located out of state. So we're taking people outside of their community, outside of their culture, away from their family, away from what they know as protective factors and cultural factors, and cultural healing.
So if this alcohol tax bill passes, and if a few years down the road, $30 to $60 million a year is going to the Indian Affairs Department, what will it look like in the communities you work with?
It's literally, it would give communities hope to not only address their local needs, because Pueblos, Navajo Nation, Apache tribes, they all look different. Their practices are different. Their approaches are different. Their land is different, right? So what they can actually implement in their community looks very different for all of the tribal communities. So this would mean being able to provide prevention services. Currently, our state does have prevention. But for over 20 years, prevention programs have received about $100,000 for an entire county for 20 years. So the amount of impact that has right now is limited because of the limited funding. But that means that tribes could then create prevention programs that work for them, treatment programs that work for them, a residential treatment program for tribal community members with cultural healing, with medicine men, with cultural, people always talk about culture being prevention. With cultural activities and reintegration into culture, there's such loss of language, such loss of cultural practices. This would allow for all of that to come back in.
Now let me play devil's advocate for 1 minute. This bill would add a 6% tax on drinks that you get at a restaurant. So let me just ask you, why should I, as a restaurant patron, pay more for my glass of wine when I go out to dinner? And why should restaurants have to charge more and therefore sell less? Why not just spend money that we've got already?
So a couple of things. Number one is increasing the price of alcohol is a public health strategy that is known to be effective. The CDC, the World Health Organization, and our Department of Health all support it. That in itself, increasing the price in itself is the strategy. So that's one.
You're trying to make people drink less alcohol.
Exactly.
You want them to buy less and sell less.
Exactly. The goal is to have folks drink a little bit less. So that might mean you might go out with some friends and drink 2-3 glasses of wine. The goal would be, can you drink 2, right? And any improvement in the amount of alcohol that is being consumed would increase, health outcomes would be through the roof. In addition to that, we do know that there is alcohol-related data. I just looked at the YRS data for 2025. Middle school, 41.2% of middle schoolers are binge drinking. Exactly, middle schoolers. So at some point, the price of alcohol does need to increase because we know that it's an effective strategy. The other thing is we have gone out to community members, and I've gone out to talk to adolescents and 20-year-olds, and they say that they're consuming and binge drinking at massive rates. So what we consider heavy drinking, they're doing in 3 or 4 days in that week, right after work, and then still driving. So we know that there needs to be a decrease. The other thing is almost everyone that I've asked either does not know how much they pay in alcohol taxes right now, or 2, they are willing to pay an extra amount. They were even willing to pay an extra 25 cents at one point when we originally introduced the bill, because they know that we have the need in our state.